Today is the day of the surgery, so I am here early in the morning. We're gonna get started. So pretty much, I'm just gonna show you my hairline. So that is my current hairline, and I've always had this hairline. Like ever looking back into my old photos of me, I've always had it. So yesterday's video, as you saw, the doctor was just kind of outlining what he would say is the ideal sort of shape for my hairline. Because currently right now, this part, proportionally to my face, is like great. So based on the shape, the doctor wanted to bring out more of the hairline here, so that once it's done, my forehead doesn't look very wide. So we don't want a low hairline, but a wide forehead. So what he's gonna do, he's gonna bring the sides in here a little bit more as well to kind of balance everything out.
One eternity later.
So I am back from my hairline surgery. So this is going to be a two-parter, essentially the extraction of the donor hair and then the implantation of the donor hair in the front of the hairline. So the total surgery time, it was about 5 hours. So let's start from the beginning. So I got in this morning at around 9. We did some paperwork. The doctor took blood samples as well as blood, because they have to do something called PFP, where then they'll take that extra liquid essentially, and that's going to help essentially stimulate the growth of the follicles and help it essentially survive the whole entire process. When you get in, what they do is they shave the back of your head. That's where my donor hair is coming from. I did the FUE extraction, so it's the follicle unit extraction. So instead of cutting a full strip, they go in and essentially selectively collect follicles throughout the whole entire back. So for guys like me who don't have long hair, I like my hair cut short. That way it more so kind of blends into your natural hair, so it's not as obvious. Rather than if you did the other version, which they take a whole strip, you have an actual scar line, where if you have long hair, that's not as big of an issue because you'll always have that covered up. Then they essentially inject you with local anesthesia and numb your whole entire back of your head. Once the numbing set in, which was really quick, really honestly the whole entire process, that was only the painful part, was the local anesthesia when they were sticking the needle in the back of your head. And that was the only part I was like, oh, it felt like somebody was poking you literally with a needle. But once the anesthesia kicked in, you felt nothing. The only thing you really would feel is the pressure. And of course you hear and kind of feel the pressure of the drill kind of going in and extracting out the hair. So what essentially is happening is the doctor goes in with a 0.8 millimeter sort of drill that will punch a hole into every single follicle, and then the assistant behind him will go in and essentially pluck out every single hair follicle that the doctor had drilled a hole in. So the whole entire process, that took about 2 hours, I would have to say, but honestly it felt pretty quick. The only uncomfortable part about that, outside of the needle injection of the anesthesia, is you have to have your head facing down, and you're in this horseshoe-shaped pillow the entire time, and you don't see anything. It's pitch black, and you would have to have your neck to the side for the duration of time the doctor's going in, and then the other side. So you kind of get a kink in the neck after a little bit. But really, that's the only uncomfortable part about that whole entire aspect. You feel the pressure, you hear the drill going, and then once the assistant was going to pull out every follicle, it seems like they would have to tug on some of them, and if it wasn't drilled, you would feel your scalp kind of getting pulled back. And I was like, oh no, I guess they didn't punch deep enough. But anyway, so she would have to move on to the next one, and then of course that one popped out. You also hear a clicker, by the way, on the side. I think she's using her foot. She's counting, I think, the follicles that they're extracting, because the total that they took, they essentially said was about 3,500 units of follicles that they took from the back. So I think she was just kind of keeping track of how many they were taking out. And that is the first session. Right after that, they clean you up, and then you take a really quick break. We sat in the waiting room area, I guess, for the doctor to clean up and get ready for part 2. What they would also have to do is go in, from my experience of watching other people's videos and other doctor videos, is they go in and separate the follicles from, I guess, all the other excess material that is not needed, and then divvy it up into these little dishes, and they clean it up with the plasma that they extracted from your blood so that they can use that to implant into the front of your hairline. So now we are ready for part 2, and this is the exciting part of it. You go back into the room. The doctor actually first kind of measures out and kind of graphs out the line of where the new hairline will essentially be. So he did measurements based on my face and my ratio, and he essentially came up with this line here and says that this best matches my face. And he also says that for more of a masculine feel, he says to do a right angle rather than a curve, because a curve gives off more of a more feminine feel. So he essentially went along with my original hairline right here, because he says that is actually quite low for my face shape. So he was like, I'll go with there. And he actually brought it up a little bit higher than here, because my hairline's actually right here, but he brought it up like I would say a 1/4 of an inch higher, and that's where he started. So he designed the hairline for me, and once we've agreed to it, I lay down, we sterilized, sanitized my forehead area. Yet again, they went in with a local anesthesia, and of course, that is the most painful part of it. Actually, in the very beginning, they actually put a patch of numbing cream right in the center of my eyebrows. First round of local anesthesia, I wouldn't feel it as much because apparently there are nerves that connect from the center of your brows to your forehead, and those are 2 main channels that needed numbing. Once that was done, he went in and did the anesthesia all around where the hair follicles were going to be implanted. So that honestly were the most, painful. It's really not painful. I mean, pain from 1 to 10, I would say was like a 4. You felt like little pricks along there. So the doctor started implanting the hair follicles. We had to go back and forth so that they made sure that the follicles were even on both sides. Apparently on my right side there was a slight scar, and I didn't ever realize that I had a slight scar in here. So he was saying that may have a lower chance of surviving from the follicle implanting over the scar. But essentially they went through and above my natural hairline, and they implanted a little bit more because they had extra, which is always good. So they went a little bit further up, so it kind of has more of a seamless blend between the new hairline as well as the original hairline. So if you are not good with blood, I do apologize, but this is essentially how it looks. I will post more up-close photos. Essentially, after all the implantation was done, they sprayed it down with more of that PFP solution so that it guarantees more of a higher survival rate of the follicles. So they spritzed that down, and that's why my hair is so crazy and slightly matted looking, because I can't wash my hair for the next day. So I will have to go back in tomorrow, and they will essentially assist me in washing my hair, especially my back of my head. So this is essentially right after surgery. Swelling is apparently going to settle in within the next day or so due to the local anesthesia. So the doctor wants me to just, lay back and not lay forward so that the anesthesia doesn't run down my face. And that's what usually causes the swelling and the puffiness after surgery. I'm super excited to essentially see the final result. And as you know, I will take you guys along through the journey of the healing process. So this is essentially day 0. Tomorrow we will check in to see how everything is looking. And of course, aftercare, you also, I'm wearing a button up because they don't want anything to disturb the follicles. So no t-shirt, and if you do have a t-shirt, make sure it's a big neck hole or tank top, something that is large enough where you can pull it over without interrupting the hair follicles. But other than that, you just got to take the medications that they give you. Sleep at slight of an angle, not too high up, not too flat, just a slight angle to help with the drainage of the anesthesia and assist with the de-swelling of the face. So hopefully, knock on wood, where there's wood, that there's not much swelling going on at the end of this whole entire process. But yeah, so I will see you guys tomorrow.